My occupation is I'm a full-time flight attendant. The injury wasn't caused at work or any accident. It just like came out of nowhere. After I finished a trip, I had excruciating pain that went down my left leg. I had numbness, difficulty walking, couldn't put any pressure on it. It felt like nerves. It was enough to make you cry. I wouldn't wish that type of pain on anyone, knew that it might be coming from the back or whatever. I was able to get an appointment the day after with Dr. Memo, and he did an adjustment, and it wasn't until like maybe about 3 weeks after that I was able to get an MRI to really get to the root, and he was able to come up with a treatment plan. It was a significant injury to my back and my disc that I wasn't even aware of. And so I had options of doing just chiropractic care or physical therapy or the option of decompression table. And I chose to do the decompression table because of the benefits and the results and the long-term results that you get from it, as well as the time for the treatment plan for me. It was about 2 months I ended up starting in January 2021, and today is March 2nd, and I'm actually going back to my full-time position as a flight attendant tomorrow. The first week I did like 4 times the first 2 weeks, and then it was 3 times a week after that, as well as some supplements like collagen and other stuff that they have here in the office, which actually I benefited from. The table, when I would come in, first I would do a spinal laser. It heats up the tissue, which relaxes the muscles. And then after I did that, I would actually get on the decompression table. I'd be strapped in, and for about 20 minutes, and it would actually create a negative pressure in my spine to sort of pull that disc back in. I felt great after it. I mean, when I see how I started, where I could barely walk for 2 weeks and enough to make you cry, to where now I'm going back to flying tomorrow. I can't say enough about this, especially when you had the other options. It may have taken a lot longer for my recovery. I recommend this for anyone to give this as an option. You won't be disappointed, and my MRIs actually are the proof, because I had my second MRI today, and there is a significant improvement in just 2 months than my first one. So this does work for spinal injuries and anything not to have to get surgery. This is the route to go, and I'm very pleased, and I can't say enough about the treatment plan that he put together for me, and he goes over everything with you. You always have your options, but my option was to do the decompression table. I don't think you'll be dissatisfied with it.